We welcome Dr. Robert Rutledge from Las Vegas, USA to Kular Hospital, Bija. Welcome, Dr. Rutledge.
Thank you. It's good to be back again, Dr. Kular. I appreciate your invitation. And it's exciting to be back and see the success of your program that you've had here in Bija. So this success is being recognized, I can tell you, around the world. I'm happy to celebrate the successful publication of your two articles in the world recognized leading journal of obesity surgery. And that publication, I think you can be very proud of, and I'm happy to be part of that and come back and visit here in Bija.
Great. So to introduce Dr. Rutledge, I must tell he is the father of mini gastric bypass surgery. He kind of invented the mini gastric bypass in 1997 in US, and he started it for the very first time in the world. And now, as we see, mini gastric bypass has been considered to be the safest, shortest, simplest form of bariatric surgery, which is at the same time the most effective of the commonest procedures being done and being available around the world. So mini gastric bypass is being followed in different countries of the world. You talk about France, Italy, Europe, I can say as a whole, in England. Now last year we started one center in Sunderland. Yes. They started doing mini gastric bypass. And throughout India also, the mini gastric bypass is becoming more and more popular. And Dr. Rutledge, could you just tell me what are the special things in mini gastric bypass? Why is it becoming so popular these days? What is the reason behind this?
Well, that's a good question. So the mini gastric bypass is an operation. And as I think all of us, when we think about surgery, the first thing we think about is, I don't want surgery. If I have a cold, if I have an illness of any kind, if I had my preference, I don't want surgery.
You're right.
But let's imagine that we suffer a serious illness, diabetes, heart disease, problems like this. If I must have an operation, let me say, there's a kind of operation I would like.
You have to face that.
I would like. Make it short.
Yeah.
Make it simple. Make it as painless as possible. And make it effective. In other words, I want an operation that cures or treats my illness, but I want one that has these other benefits. There have been many operations for obesity, and they are good operations. We respect and complement the other types of operations. The lap band is used in the United States, sleeve gastrectomy, and the Roux-en-y bypass. These are all good operations, but most people would say that they have limitations, that they are imperfect in ways that you know. But the mini gastric bypass, to me, when I think of it, has many of the features of an almost ideal operation. And I think your paper, which you studied, your results in 1,000 mini gastric patients here in Bija, is an excellent demonstration of these good qualities.
Yeah. There are another good things which we learn from the patients about the mini gastric bypass. The very first thing which my patient would say on day 2 or day 3 of surgery is that they can eat. I mean, this was something very rare to see after bariatric surgery, and
after any surgery.
Normally we tell the patient that you have to be on liquid diet for 6 weeks, and this is what our Punjabi patients like. And on surgery, they start with semi-solids, and then they can take solids. Right. And then another good thing is that the pouch, the size of the pouch is big. So mini gastric bypass gives some luxury to the patient to eat a moderate amount of diet, right, which is good in two ways. It satisfies the brain, the upper story of the patient. Number two, at the same time, patient can take some healthy diet, which is otherwise a side effect of the surgery. If you're losing so much of weight, you can have some deficiency. But that's what we see in our patients in mini gastric bypass, because it gives some luxury to eat. So patient can eat, patient can enjoy the food, and at the same time, patient will lose good amount of weight with lesser chances of getting the deficiencies.
Right, and now comment on that feeling. No, this is for you. You comment. Mm-hmm. Comment on that feeling of a patient who's had mini bypass and ability to eat with those patients who have a lap band or a sleeve or a Roux-en-y when they try and eat. What do they say?
Yeah, I keep on comparing my patients. When we started with bariatric surgery, we were doing all different kinds of surgical procedures like the Roux-en-y gastric bypass, sleeve, and we have been getting patients of lap band. We have taken out many lap bands and converted them to mini gastric bypass or Roux-en-y gastric bypass. In short, what I want to convey is that the difference in the quality of life, in the happiness score after MGB, and if you compare it with other procedures, basically what I understand is that in the old practice of bariatric surgery was basically limited to severe restriction. May it be band, may it be Roux-en-y or sleeve, it would give you a severe restriction which most of the patients don't like.
Right. Think of this, I will get my weight loss by pulling my belt tight.
Yes.
No, tighter. No, tighter. And your own study, again, my compliments, your study, you looked at a kind of operation called the sleeve gastrectomy, yes? Mm-hmm. Which you are honorable, you tried it, and we studied it. And the sleeve gastrectomy makes a very small, narrow stomach. And with that small, narrow stomach, the patients lost weight, right, initially? Yeah. But could they eat 2 chapatis?
No. You
what?
Cannot eat
tell us, what does a sleeve patient say to you?
See, this is like, there is some difference between restriction and obstruction. Exactly. If our restriction starts going towards obstruction, then the problem starts. Patient doesn't like obstruction. So that's what I have been noticing in my patients. Yeah. Even if I was doing a sleeve, it would be slightly looser, slightly MGB-ish kind of sleeve, so that the patient doesn't feel tight. But all the times this has been my concern and my patient's problem. If we make it too tight, as I used to do with sleeve or Roux-en-y, because the pouch is too small in that, so they feel obstructed here, which gives them a feeling of uneasiness.
Well,
as I compare them with my mini gastric bypass patients.
If you take a big bite,
yeah,
a giant bite, and don't chew it well, and you swallow it,
yes, yeah,
that feeling,
yeah,
that's what you said, obstruction, that word obstruction.
Yeah.
Another feeling is I'm restricted, I'm full.
Yeah, restriction means eating a moderate amount of food, but with ease, with comfort, then I'm done.
I'm done.
That's what the mini gastric bypass gives to the patient. That is the reason why the mini gastric bypass has a long chain of patients. That's the reason. One patient is getting 10 patients.
We ask the patients. We ask your patients, will you send your brother, your sister, your mother, your father, your child for MGB? And your clinic tells us the answer. It's full. And we also ask, again, the sleeve is a good operation, but in 5 years we ask Will you send your brother, your sister, your mother? And very much less people with sleeve. Your own patients told us. Now, if sleeve was good and patients were happy, we would do sleeve. Yeah. Right? We'd be happy. We don't mind. But now we see obstruction because they eat into that small pouch, which has a tight outlet, the pylorus. And they have this feeling with pain and throwing up.
So, yeah, that's what I have understood out of my 7 years of practice into bariatric surgery. Basically, I owe my practice to you. I have learned everything from you.
No, from your patients. Our patients tell us.
And when we see it from the patient's point of view, patient's perspective, patient doesn't want obstruction. So, eating is a big happiness. We don't want to kill this happiness.
We want to enjoy.
So we want to enjoy, we want to relish the food.
But maybe not quite so much.
Not quite so much. Otherwise you can kill any procedure. No procedure is perfect.
Right.
At the same time, I must tell, morbid obesity is a difficult disease. Yeah. And all the patients have got different kinds of behaviors. They are eating different kinds of foods. So no one procedure can be perfect for everybody. And what good thing in MGB we have is that the dose of the procedure can be tailored according to the patient. Oh. If you get a patient, yeah.
Wait, you've changed topics. You've changed. We were first talking about the enjoyment of eating, the joy of many people. If you think of the joys you have in your life, one is to have a good meal. Okay, and we said the other operations are good. They're good, but the blockage, okay. Now, another question, another topic is effectiveness, okay, power. If I am heavy and I have a treatment, I want effectiveness. And also, if I am very big, I may need a more powerful operation. And if I am only a little bit big, but also with diabetes, I may need a smaller operation. And the mini bypass has the attraction, and this is the topic you're bringing up now, to say, you are very big, you are very sick, I need more power, or you are thin but you have diabetes, I need less power. In contrast to lap band or sleeve, or Roux-en-y, the MGB's ability to be tailored, just like your suits.
So that's what I like out of this procedure. It can be tailored according to the patient. Right. Like you see, one tablet cannot be good for everybody. So somebody needs a 250 milligram, somebody else might need a 500.
Yes. Or the dose of antibiotics for a child is different than adult.
Yeah. Huh? So this is one good thing which I like, and then another thing. No procedure is perfect. If some patient is coming back with a weight regain, so we need some good solution to fix it again. So we will not push our patient to the dietitian.
Again, so then we say you must tailor it.
Yes.
But then we said, what if there is a failure? Is any treatment perfect? No. So let us suppose that you go to the surgeon. You say, I want this operation, and you get it home and you say, I don't like it. I don't want it. Or there's some other problem. We call it the exit strategy. How do I get out? I want out of this operation for whatever reason. Maybe you need more. The power needs to be more. Or the power is too much. With the sleeve gastrectomy, as an example, the stomach is cut out and they throw it away. So there's no way out. It's one way. MGB, if you don't like it, undo it 30 minutes, 45 minutes. It's revisable. It has a good exit strategy. There is a way out.
Yeah, this is the thing which I love about mini gastric bypass, because we are dealing with human beings and their weights. We are kind of bringing them down. And what if they go too much down? So
surgery can be too powerful.
Yes, it can be too powerful.
Very powerful.
So it has got good exit strategy, safety, efficacy, easy reversibility, revisability, different dose for different patients.
Right.
What else we want?
Yeah.
And then about the side effects. You want to say about the side effects of this surgery and what should be, how to handle it?
Sure. All kinds of treatment. If you take an aspirin tablet, every medical treatment has good but also has some bad side effects. An aspirin, you could have bleeding, you could have an ulcer, you can have an upset stomach. So mini gastric bypass in the same way does have some side effects. Again, what makes it attractive to me, side effects are so low. They are very low and you can treat them. So one of the side effects is actually a benefit. So let's imagine that you eat too much too fast. Then you'll feel uncomfortable. Well, that's a way for you to realize you've eaten too much. So a side effect of the MGB is a method of it telling you, you can have one chapati with MGB. Your patients tell you this? Yes? No trouble.
Yeah.
2, most of the time?
Most of the times they can take 2.
3?
No.
No.
Not all of them. Very rarely.
So this is a side effect. If you say, well, I want to eat a lot fast, a side effect is,
Yeah.
I can't. So it's working by doing that. Now, when you have this, you also need to eat a healthy diet.
Yeah.
And a side effect would be you could get an ulcer or gastritis, an upset stomach. You could have low iron or things like that. So you have to be appropriately cautious. To me, I think of if you buy an expensive car, then you need to take care of it.
Yeah, it needs some kind of maintenance, some kind of servicing,
Yes.
and that's what I keep on telling my patients. This is like a good gift from our side to the patient, and they need to, handle it with care.
Right.
So if they handle it with care, then it can work for life. Otherwise, we can kill the procedure.
Dr. Rutledge, why you prefer Dr. Kular to have the surgery of your own
Relative, close relative?
relative?
No, that can be. You want to say something?
Yeah, absolutely. I think it's a good question. In other words, what we were talking about is, what do I see in you, in your hospital, in you as a surgeon, and your patients? May I comment? I have had the good fortune to operate in many hospitals in the United States. I've had the good fortune to be invited to be a teacher and a professor of surgery in the north of England and Sunderland, in London, in Paris, in Germany, in the Czech Republic, in Italy, in Spain, in Turkey, and through many cities here in India. What I would tell you is that I have seen Dr. Kular operate. I have seen his results and seen his patients. I brought my own family here to have surgery with Dr. Kular. And I would tell you that his results and his skills are equal to or better than any other hospital in the world.
Thank you very much, sir. I'm honored. But I owe everything to you. It's because of my 7-year association to you that, we could get into so much details of this bariatric surgery.
But wait, you say that's good. That's a good thing, and I thank you. But let me say another thing. If the results of MGB were not as good as sleeve or other surgery, we would choose the other surgery. We are choosing mini gastric bypass because when we see our patients, when we care for our patients, when we go to other surgeons and other hospitals all around the world, we keep seeing one thing. Other operations are good, but it seems to me, always we find patients having mini gastric bypass seem to do better to me.
Yeah, this is the happiness coming from the patient side, which we are mostly concerned. So I think it was a good discussion on mini gastric bypass. You have something more to say as a last word of caution to our patients?
Yeah, the only thing I would say again is that what we want in an operation is efficacy, that is power and effectiveness, but we want safety. And again, what I would say, and I think it's something that you should be very proud of, is that I have had the opportunity to look at, to operate with surgeons from all around the world. And I've had a chance to look at your results. We have published your results. Your results, good quality, good outcomes, are as good or better than any other hospital, any other surgeon in the world. And I think my congratulations to you.
Thank you, sir. Thank you very much.